See where she's at?
All right, you guys ready to get started?
Sure.
Okay.
Just a couple seconds here.
Okay, just let me know when you're ready, John.
Okay.
One, two.
And we are live.
Good evening, everybody, and thank you for joining us. Welcome, everyone, to our town hall here with the Center for Closing the Health Gap. I'm so excited to have this conversation with you guys. We have a panel of some of the most amazing experts, and we are going to talk you guys and get your questions answered about our topic. But let's welcome everybody out to our COVID-19 Community Resources Town Hall meeting powered by the Center for Closing the Health Gap. I'm Tropikana from 101.1 The Wiz, and I'll be your moderator today, along with Vice Mayor Jan-Michele Kearney, who will be joining us a little bit later. Generational health issues affect thousands of Black families across Cincinnati, and we all know that and are affected by it. And not just here, but around the country. So today we're going to talk about the impact on our Black community of diseases such as diabetes, kidney disease, long haul COVID, and others. Now, this is a part 2 of a conversation that we started at Corinthian Baptist Church. And I want to thank you guys for joining us for that conversation on March 7th, when our experts on the panel today joined a family living with diabetes and Donna Jones Baker, who received a heart and kidney transplant. We're going to continue the discussion with our panel of healthcare experts and 2 sisters who are also living with diabetes. First, I got to say a very big thank you to our tech team, John and Durant. Hi, guys. And remind you that we are taping this session so that we can repost it for those who might not be able to join us at the moment. Our program today is presented in partnership with the Cincinnati, Ohio chapter of the Links Incorporated. So let me introduce the president of the organization, Dr. Marshall. Hi, Dr. Marshall. You want to say a few words?
Sure. Hi, Tropikana. Thank you so much for that introduction. Good evening, everyone. I bring you greetings on behalf of the Cincinnati, Ohio chapter of the Links Incorporated. We are delighted to partner with Closing the Gap and a host of community partners in presenting tonight's virtual program. You know, as we think about supporting the Black community, we know one of the best ways to do that is through education. And tonight's program is designed to provide information, tools, and resources to support our community in dealing with several medical issues such as diabetes, kidney disease, and long-haul COVID. So thank you so much to the organizers and to our dynamic group of panelists for sharing your knowledge and expertise with the community. To our audience who's joining us this evening, thank you so much for tuning in. We hope that you find tonight's webinar informative, but more importantly, we hope that you carry information that you learned tonight back to your family and to your friends so that we can really work to eliminate health disparities in our community so that we can close gaps, but more importantly, so we can have a vibrant and thriving community. Thank you so much.
Thank you, Dr. Marshall. Now it's time to meet our panelists, a few of my favorites. They're going to absolutely give you the answers that you need, the way you need to hear them. We're going to go ahead and introduce our panelists, but I want you guys to have a chance to get your questions answered. So if you're on Zoom or Facebook, please feel free to go ahead right now and start entering your questions as our speakers are speaking. Dr. Henderson, how are you this evening?
Fantastic. How are you, Tropikana?
I'm doing well. You want to say a few opening words on why this conversation is so important this evening?
Sure, absolutely. First of all, thank you for allowing me to be here and to participate in this panel. I am Dr. Clyde Henderson. I'm a board certified orthopedic surgeon. I'm a graduate of Walnut Hills High School, the best high school in the United States of America. Yeah, how about that? Went to Northwestern for undergraduate work in material science engineering. Then I attended University of Cincinnati College of Medicine and the Medical Center for my orthopedic training. I practiced in Cincinnati for 33 years before retiring about 5 years ago. Even though I retired from orthopedics, I wasn't finished. And I'm not finished with medicine and helping to take care of people. I learned early in my training that I needed to be a physician first. And when COVID struck our community, struck our country, it was clear to me that it was having a disordinate impact on the African-American community. So I started to write and to try and educate community members about COVID-19. So it's now 3 years later, and about 90 articles that I've written over that time frame. Long COVID is has a big impact on our community, as does ongoing COVID-19. And I'm here to try and contribute to the conversation and continue to educate. Thank you.
Thank you, Dr. Henderson. Dr. Jones, how are you this evening?
I'm doing well. How are you doing, Tropikana? It's good to see you again.
Good to see you as well. Do you want to talk about why this conversation is so important?
Absolutely. So I'm a pediatric endocrinologist at Cincinnati Children's Hospital. I did my training in Louisville, Kentucky, and was an Aggie. So I went to undergraduate at Texas A&M. And I started to work in diabetes field at St. Louis Children's Hospital in Louisville, Kentucky. In St. Louis before I came to Cincinnati Children's Hospital, where I continue to do work in diabetes. So I work both in type 1 and in type 2 diabetes, but there is an exponential rise in the rates of type 2 diabetes amongst our children. And if you are an adult living with type 2 diabetes, your children are at increased risk for also getting type 2 diabetes. So it's very important for us to have this conversation so we can make sure we prepare the next generation.
Thank you so much, Dr. Jones. And of course, Ms. Beckham, nurse practitioner from University of Cincinnati. How are you doing today?
Good. How are you? Good to see you.
It's good to see you too. You want to share a
Yeah.
few opening words on why this conversation is imperative for us?
Absolutely. So I'll just start with my background. I'm a proud CPS graduate. Go Hughes. Also a dual. I went to University of Cincinnati for my undergrad and grad. I currently work at the University of Cincinnati under the family medicine umbrella, under the geriatric division, where we want to talk about normalizing end-of-life conversations. But through my journey, started off at Christ in pulmonary and sleep, and just really found out that education is something that we need in our community to help save us. So we know that diabetes and kidney disease and long haul COVID is something that we see in our community a lot, but we really need to know and be transparent about how it really affects us. So prediabetes, 1 out of 3 people will have diabetes or prediabetes. So that is very scary. And then 70% will turn into type 2. So all of these things that we need to really talk about to be on the preventative side that I think that we could save us. So thank you for having me.
Thank you for joining us. And we could have this conversation with our very well-trained experts, but an expert is usually somebody who experiences these situations as well. And tonight we are joined by 2 sisters, Michelle Connor and Miss Pauline Turner. Would you ladies like to introduce yourselves and just share with us why this conversation is important to you personally? I think you might still be on mute. Can we?
Here we go.
All
I
right.
am trying to become technically savvy. However, it's very important to me because I've seen my grandmother inject insulin when I was a child. I've seen uncles and aunts lose limbs. And now that I have been diagnosed in 2006 with it, trying to gather as much information as I possibly can to make a change and help my children as well as grandchildren make changes. So we have been trying to go on our journey of dieting, and I won't take too long, but this 12-week diabetes challenge is really giving me a lot of information. A lot.
Diet, and I got the blues as soon as you said diet. Every time we had this conversation, it's about diet.
And that's because that's all I ever heard from a doctor when I went to go see him was, you need to lose weight. But when you ask them how, and when you tell them that you're trying, and it seems as if the harder you try, the less you lose. However, since I've been in this program, I have lost 7 pounds and I am just so tickled.
Yes.
So that's a good start for my beginning.
Yes,
But
ma'am.
that is just to get this information so that I can pass it on, not only to my family, but friends and anyone else who will listen about making those changes.
Yes, ma'am. Saving lives. Miss Pauline, would you like to share? a little bit about yourself and why this conversation is so important, you're gonna have to hit on mute first. Click right down there in the bottom left corner of your picture, and you should see a red microphone. John, are we able to assist her by unmuting her? Okay,
Not able to do it from here, unfortunately.
okay, Miss Pauline. And you can't see how to unmute yourself. Okay, if you can, but it's trying to read your lips.
Says, sounds like it won't let her unmute for some reason.
Won't let her unmute. You may need to log out and re-log back in with us. Can you try that for us? And as she's working through that, I just want to reiterate this conversation. If you have any sensitivity about how much food you eat, and you're going to be real mad today by the end of this conversation, but your life is going to change for the better. For me, it does every time, especially when these wonderful experts get to sharing with you why changing your diet is going to change your life and prolong it. Now it's your turn to ask questions. If you're on Zoom or Facebook, you may enter your questions and comments right in the chat area. We'd love to know your name, but it's also okay to be anonymous. We'll start with Dr. Henderson, Dr. Jones, and Ms. Beckham. Now, we've talked about diabetes and why this conversation is so important, but why is diabetes so prevalent in the Black community? Anyone who would like to address that conversation? Dr. Henderson?
All right, sure. I'll go at it first. I think it's prevalent in our community because for a couple of reasons. First of all, you have type 1 and type 2 diabetes, as already discussed. The type 2 is the what used to be called adult onset, but we're seeing it more and more with our children, and it happens because the habits that we have adopted as far as what we eat and how much we eat. The lack of exercise, the fact that we're more sedentary than we used to be. When we were growing up, some of the older folks, when we were growing up, we'd go outside and play. But now the kids are sitting at their computers and they're not playing, so they're not burning the calories. And then they become overweight, and it makes us more prone to developing type 2 diabetes.
And there are other factors besides patient-centered factors. There's also like community factors and system-related factors. So, we tend to be a very tight-knit community. So when we get together, what do? We eat, right? And of course, if we know somebody with diabetes, we don't tend to talk about it. It tends to be stigmatized. And so then, therefore, we don't even know that we have the symptoms that Auntie may have had. And sometimes even it's a system problem, right? We have a lack of access to affordable healthcare, lack of access to green spaces where our kids can, play, and then lack of access to, those healthy foods that might otherwise allow us to be healthier in our lives. So there are definitely some systemic problems that also increase the rates of type 2 diabetes, kidney disease in the Black community.
When we think about this conversation and we started the same way that I said, oh no, we about to start talking about food again today. It has always been in our community that we gather and we show love around food. And I know as a member of the community and being a mother and a child of that old school parenting and those old school traditions of gathering around these big meals, we think about how we have to sacrifice tradition and family and heritage for a healthy lifestyle. How do we kind of change that notion that we can still have those same traditions, but in a healthy way that can prolong our lives? Can you kind of speak to that to Dr. Jones?
Absolutely. So, definitely a family that plays together stays together, right? So there's opportunities.
It's not a family that eats together.
We're changing the narrative. Right? So, it's a family that plays together. So, if you do have opportunity to go into green spaces, go to the park, right? And we have gatherings there, right? Go, downtown to the banks and walk along the water. Take the kids out for a walk, go bike riding. So there are other opportunities for us to be physically active together and again, play together that doesn't necessarily center around food. And one thing to remember is everything in moderation. So, we know we're going to get together and eat at Easter and at Thanksgiving and at Christmas, but we don't have to eat every Sunday, every Friday night, right? Every Monday. So we just have to do things in moderation. So we don't have to lose those traditions. We can just kind of modify them a little bit and change the narrative on how we get together. The board games is another good way for our community to kind of stay engaged with each other. And that may not require a lot of physical activity, but it is still that bonding that we get when we get together on holidays and other occasions.
Just changing our thought process about what it is that we gather around. Now, to Ms. Michelle and Ms. Pauline, if you were able to figure out the mute situation on your end, at the March 7th conversation at Corinthian Baptist that I had an opportunity to host, many members of the audience shared their struggles with controlling diabetes. Can you share what your experience has been? Ms. Michelle or Ms. Pauline? I think we're connecting to her.
Okay. Portion control, and also not just reaching for the first thing that I get my hands to. In other words, starting to eat to live instead of living to eat. And I have to thank my son-in-law and my daughter for that, because they eat pretty healthy. Even though I was trying to interject my ham hocks and my bacon fat and so forth. But since I'm came from Alabama here in Ohio, they have helped me to transition from that type of style of cooking to a more healthy style, using like olive oils and more baking and broiling instead of frying the foods. And also making more healthy choices instead of a bunch of cakes, cookies, and pies. Let's make fruit trays now, different things to that extent.
Now, I heard you saying that you transitioned from the South to Ohio. That's a completely different cultural behavior when it comes to cooking. I heard you said you started off cooking with ham hocks and transitioned into healthy lifestyle changes. How difficult was that for you? And what were maybe a couple of tips that helped you?
What was difficult was the fact of the taste. However, after they introduced me to different seasonings, that helped with my taste buds, to develop my taste buds to try different flavors. Because like you said, I was just set in my ways. I thought nothing replace all that lard, butter, fat. But, after trying the different seasonings and spices, it has really changed my taste buds. The hard part was when I would go off not to buy that submarine sandwich loaded with all that cholesterol. But they have helped me to make better choices.
Thank you for sharing, Ms. Michelle. We're going to have to come back and find out what some of those seasonings were that you switched over to. Ms. Pauline, would you like to share a bit of your experience?
Yes, my experience as far as cooking, I have changed the way that I cook. And I've also changed the food items that I buy, my choices as well. I don't go and I don't pick up, all the sugars. I left all the snacks alone, and it was no problem for me to just really adapt to the change. So
We didn't get a chance to hear about your story in regards to battling with diabetes. Can you give us a little bit of your background and what your experience was?
Oh, well, my experience with battling with diabetes was just that I was getting to the point where I was like tired a lot and just real thirsty a lot, things like that. And I realized then that I needed to, have a visit with the doctor. And then upon finding out that, yes, that I did have pre-diabetes, that's when I knew that I had to change my lifestyle. And that's when I began to make the change.
Now, Dr. Jones and Dr. Henderson and Ms. Beckham, first thing she just said is that she found out that she was tired all the time. A lot of us are tired all the time. How do you know when you need to go see if it's more than you're just tired all the time?
Well, for me, I knew that I needed to go and see, because after knowing that I was getting my rest, I knew that I was going to bed. I knew that I was getting my rest, my 6 to 8 hours of sleep. However, I was just still finding myself so tired, and I was like drained. And then I was like sleepy, and I was like, how can I be sleepy when I just had 6 hours of rest? And so I knew at that point in time, it was time to visit with the doctor.
Thank you. Dr.
You're
Jones, can you speak to that a little bit?
Absolutely. So, diabetes is a process in which you have high blood sugars, and sugar is really the body's fuel, right? It's what their cells utilize to kind of get us through the day, how we walk, talk, breathe, and do what we do. It's kind of like gas for our car, right? And so if you have diabetes and you're not able to make insulin, and insulin is a hormone that takes those sugars and puts them inside of the cells for them to be utilized for energy, then basically your cells are essentially starving because the blood sugar stays outside of the cell and doesn't go in the cell, so you don't have the energy to do what you need to do. And like Ms. Turner said, it's a tired that's a little bit different, right? So I'm tired now, but it's a tired where you can't get through your activities of daily living. And that's when it becomes and reaches a level by which you need to see the professional. Also, increasing in thirst, increased urination. Those are also very classic signs for diabetes.
Okay. Dr. Henderson, is there anything that you would like to add to that, or Ms. Beckham?
One of the problems I think we have in our community, which leads to a lot of these healthcare disparities, is the fact that we don't regularly see our physicians. And if you have regular appointments with your physician will be screening for diabetes and prediabetes, and you may catch it before you actually have any symptoms whatsoever. And that will be a good thing to happen. And that's one of the disparities that we really need to work on, amongst many others. But first of all, there's not access, and then the folks just don't go. And when I was practicing, I found that the men were actually much less willing to come to the doctor than the women. So I applaud you all for getting to your doctor, hopefully before you feel bad.
Regular checkups preventative measures. Now, not only did we talk about diabetes on March 7th, we talked about kidney disease. Is kidney disease becoming more common, or are we just talking about it more? Ms. Beckham, can you talk about that a little bit?
It's really
dealing with?
I'm sorry.
Is it something that we've always been dealing with?
Yeah, we have, but the thing is that race-based medicine have emerged, really been informative in regards to confronting the Black coefficient of the GFR, meaning that when you look at your lab reports, there's a GFR, which indicates how your kidneys are really filtering out, really shows a disparity between Black and non-Black, meaning that there's a big difference in our 17 to 20% difference in our kidney function versus white kidneys or white GFR. And that puts us behind in regards to getting referrals to kidney transplants, getting referrals to nephrologists, and getting referrals to dialysis. So it really has been at the forefront. 2022, they have changed the policies now that the kidney centers are now going backdating to all of these patients that have the difference in the GFRs, which can also push them up to on the transplant list quicker. So it's something that we really need to be aware of, because we definitely want to seek care, access, and treatment sooner.
Thank you for expounding on that. Recently in pop culture, we have, you guys know I'm on the West. So my target demographic is 18 to 34 years of age that I'm talking to. And I've noticed that the idea of demographics, when we talk about kidney failure and disease, is kind of changing. When I would think about kidney disease, I would think of my parents. I would think of my grandparents. But in recent news, I'm reporting more stories about rappers who are struggling from kidney failure because they've been in a club drinking. And that age demographic is looking like our 21-year-olds that are drinking a bottle of liquor a day or buying bottles in the club. Can you guys kind of speak to that? Is there a demographic that is affected the most by kidney disease, or is that just a one-off that maybe these younger people are struggling with this, or is it something we need to change our mind about? Dr. Henderson?
The there are also comorbidities that lead to, to renal failure and abnormal GFR, such as hypertension. I think we're seeing that a lot earlier, and uncontrolled hypertension, as well as diabetes, and some of our social habits also. So we're probably seeing it at an earlier age because of that.
Ms. Beckham, can you speak to that? I see you nodding your head. Are you seeing that too, that younger generations are having to talk about this much sooner?
Yeah, absolutely. I think that with the like Dr. Henderson said, with the comorbidities that we are seeing a little bit more prevalent with the obesity, with the sedentary lifestyle, with not being tested sooner, I think that is something that we will see just because the prevalence is getting higher. 1 out of 3 will have prediabetes or do have prediabetes, which means that like 1 of 3 of us, it is something. And also the research and the evidence is there too, they are being very, very aggressive in regards to getting people tested, getting people diagnosed, so we can 30% can be reversed. So I think that we really, really need to go and get screened. And we really, really want to make sure that we normalize these conversations in our communities, not just, the stuff that we, talk about, but the things that really will save us.
Thank you. On March 7th, at the panel at Corinthian, there was a gentleman, his name was Charles Farley, who was waiting for a kidney, and Donna Jones Baker, who had a kidney and a heart transplant. So amazing. Their stories are miraculous. Donna said that she wants Black families to know how kidney disease affects the Black community. Dr. Jones, you were there at that panel, and so were you, Ms. Beckham. Can you guys kind of speak to how kidney disease has been affecting the Black community from your point of view and perspectives? Whoever would like to go first.
So absolutely. So one of the things I actually want to take it back a little bit when you talked about, the younger generation being affected by kidney disease with a higher prevalence. And like Dr. Henderson said, there are comorbidities that are associated with kidney disease, also those kind of behavioral patterns. In fact, it is known that 40% of our health is really relegated by our behaviors, right? So smoking, drinking, sedentary lifestyles. And we're seeing that in the younger generation. I mean, during the pandemic, the kids weren't going to school. They were sitting in front of the computer 7 to 8 hours a day, and rates of obesity skyrocketed, although they were already high pre-pandemic. And so childhood obesity is on the rise, and that's a increasing risk factor. Type 2 diabetes in children is on the rise. I've diagnosed kids as young as 8 years old with type 2 diabetes. And so the longer that you have these risk factors, the earlier likely that you're going to have some of these complications, including kidney disease. And again, one of the reasons that kidney disease disproportionately affects African Americans is because of those comorbidities that we just talked about: obesity, type 2 diabetes, lifestyle, access, right? Insurance coverage. All of those things really predispose our community to these chronic diseases, and not even just kidney disease, but other chronic diseases like high blood pressure, stroke, heart attack, et cetera, et cetera.
And I just want to point out that these diseases are chronic, meaning that you see this and it happens over time. So sometimes you have it and you may not know it. So you may see symptoms when they're at a higher rate, like a higher blood pressure or higher glucose or impaired GFR. All of those things that really have to, you really have to have or to be monitored in order to know. So sometimes you don't even know you have it until you really get evaluated.
I'm sorry, can I add?
Step in and ask what is impaired GFR? What's impaired GFR? I'm sorry, Dr. Henderson.
That's a good question. Thank you, Jan-Michele, for chiming in. Vice Mayor Jan-Michele has joined us, you guys. And as you can see, she's asking a great question. Can you repeat that question one more time?
So what is impaired GFR?
Good question. So it actually is indicative of how your kidneys are doing. So when they are impaired, meaning that they're not filtering the way they should. Kidneys are supposed to filter out all the bad things in our bodies. And if they don't, then it stays inside of our bodies. So the biggest thing we want to do is make sure our kidney function, GFR, is healthy.
Okay, thank you. Now, what are some of the things that we can do to prevent diabetes and kidney disease? Dr. Jones, can you speak to that?
So yeah, so look, I said earlier, 40% of a person's health is determined by their health habits. So if you're smoking, stop smoking. If you're not exercising, start exercising. If your dietary habits are such that you're eating out 4 to 5 days a week, reduce that, right? I'm not saying completely stop, but let's make some reductions in the processed foods that we get at the grocery store. I even say, you know, if you go out to eat and get a salad, that caloric density is actually much higher than if you were to make your own salad at home, right? They want to make it taste good, right? So that you get more fats, you get more calories when you eat out. So those are, and of course, get physically active. And I say, make it fun, right? You can either Zumba, there's, dancing, and there's even for the young kids, I'm always telling them, I know you guys are doing those TikTok challenges. You could burn some calories getting up and doing some TikTok challenge dances, right? So really get moving and get active is another way to reduce your risk.
Ms. Beckham, would you like to chime in on that as well?
Yeah, so just small changes. So if you are going to McDonald's, biggest thing is to not get pop, get water, not get fries, get salad. So sometimes like a big, huge 360 is very, very hard versus those small changes. So if you can do, exercise 5 times a week, probably do it just twice a week. If you can't run, just walk. If you can't get down steps, walk in place, all of those things that you can make modifications for, but just the biggest thing is just to start.
Thank you. Thank you very much. Now,
can I just add one more thing?
Yes, sir.
You can adding some exercises also helps from an orthopedic standpoint and becoming less obese, because when we see in orthopedics, the more weight you carry, the worse it is on your weight-bearing joints, like your spine, your hips, your knees, your ankles, and your feet. And so by eliminating that comorbidity, you have less orthopedic problems. It'll allow you to actually exercise even better. And let me just put a plug in for golf and trying some different exercises that people don't or may not be accustomed to. But walking on a golf course is a big bonus for a lot of people.
We have some questions from our online viewers. Camille said, what recommendations do you have about vaccinations to decrease risks of long-term COVID? Should people consider the bivalent vaccination if they have not yet had it? Can anybody speak to that?
That is a excellent question. And it just so happens that there was some huge news on vaccinations today to come out from the FDA. That news is that the monovalent vaccines are no longer being utilized, and a single bivalent vaccination is adequate for people who've not had it, unless you're over 65, in which case they're suggesting that you have 2 bivalent vaccines. So the bivalent vaccine is the one that was developed and came onto the market back in September of 2022. So the routine has been to do a bivalent vaccine on top of the monovalent or the earlier vaccines. But those earlier vaccines are no longer in use according to the FDA. They're being taken off the market, and it is a single bivalent vaccination. So if you've not been vaccinated and you're under 65 and you're older than 6 months of age, a bivalent vaccine is going to be adequate. So, and yes, it's recommended as far as helping to reduce the risk of you getting long COVID, because long COVID is something that comes after COVID. And if you can cut down your chance of getting COVID, that's the best way to prevent you from getting long COVID.
Thank you, Dr. Henderson. Since we've already kind of transitioned into this conversation, we'll come back and revisit preventative measures for kidney disease. Dr. Henderson, now 3 years after the start of the COVID pandemic, we are hearing the term long COVID. For those of you who don't know what that means, Dr. Henderson, can you explain what the difference is between regular COVID and long COVID? We don't want either one.
No, you really don't. Long COVID, also known as post-COVID conditions or post-acute COVID sequelae or long haulers disease from COVID or chronic COVID, they're all synonymous as far as the naming is compared. I mean, as the naming is. So what it is, it's not just one condition. It's a series of different conditions that can affect multiple parts of the body, from your general well-being. And I think Miss Turner, well, I'm sorry, Miss Connor was talking about being tired before. And one of the things that can happen after COVID is that you can just be chronically tired. And so and it could be symptoms as far as you're having a brain fog where you can't concentrate, you can't do calculations, you may have some trouble with your memory, it can be some problems with your heart, it could be a problem with your kidneys, it can be a problem with your gastrointestinal system. So a lot of different symptoms that can be called long COVID. They occur at least 4 weeks after your acute diagnosis of COVID, and the symptoms can be persistent, or they can come after your initial COVID symptoms have gone away. And they can last for a long time. We don't know how long, because the COVID's only been around for 3 years now, but it can be a debilitating problem. And some people have gotten disabilities is actually accepted by the government and the American Disabilities Act as a real disability.
Thank you, Dr. Henderson. How does a person know if they're suffering from long COVID? Dr. Henderson?
Unfortunately, there's no test that we have that can diagnose this long COVID. But it's basically by history, from the standpoint of you had COVID or you're exposed to COVID. And curiously, sometimes people have never been diagnosed, but they still have this brain fog or tiredness, or they're having some unexplained problems with their heart or their lungs or their kidneys. Then your physician has to consider long COVID as a possibility. But certainly, if you've been diagnosed as having COVID before, then if you develop these obscure problems afterwards, then you're said to have long COVID. And this is an actual diagnosis, which is in our diagnostic coding system now.
Wow.
And there's some, let me just add, and maybe Dr. Jones can speak to this, the incidence of diabetes seems to possibly increase as a symptom or sign rather of long COVID as well.
Absolutely. So, and especially in the pediatric population. So, I said I take care of kids with both type 1 and type 2 diabetes, and the rates of both forms of diabetes increased significantly after COVID. In fact, in type 2 diabetes, there was a 77% increase in rates of type 2 diabetes amongst our youth, boys more prevalent than girls. And typically it had been the girls that were getting type 2 diabetes. So definitely children and teenagers are no strangers to long COVID symptoms.
Wow. Can you speak to or kind of expound on that? The girls were being diagnosed differently from the boys?
So no, typically prior to the pandemic, girls' rates of type 2 diabetes were way higher than boys. The incidence was probably 2 to 3 times as high in young ladies than it was in boys. But after the pandemic, it actually increased rates in the boys. The boys actually had higher rates of development of type 2 diabetes post-COVID. And again, a lot of that is attributed to the sedentariness of, what the pandemic created, right? So kids were no longer getting up and going to school. And I would tell you, even the kids that were not in sports, right? They were still getting up, walking, going to the bus stop, walking at school between classes, and all that physical activity stopped, right? So even amongst the kids that weren't athletes, there were also rates of increase in obesity and type 2 diabetes.
Wow. Is there anything that we can do to avoid long COVID? And if I don't, what is the treatment? Is there a treatment that can cure long COVID, or is it something I can do to counteract the symptoms of it? Dr. Jones or Dr. Henderson?
The way to best avoid long COVID is not to get COVID. And that comes, I'm not being flippant, but that's the bottom line. So do everything you can not to get COVID. Get vaccinated. Know what's going on in your community from the standpoint of the level of community spread, and which is available on CDC websites. If there's a high level of community spread, then you take precautions when you're out to have your mask available when you're going to be in settings that are not well ventilated, are going to be very crowded. Still, wash your hands. If you feel sick, don't go out. And if you test, you can have home. We should all have some home testing kits. You test if you're feeling ill, And if you turn up positive, then you should call your physician to see if you're eligible for actual treatment. There are some studies that show that some of the treatment for acute COVID, the drug called Paxlovid, shows a decreased incidence of long COVID for those people who have taken it for acute COVID syndromes. So if you test positive and you get treated, if you're eligible according to your physician, and still, as we talked so many times, make sure you're washing your hands, and wearing a mask when necessary, and getting your vaccinations.
Absolutely. Dr. Henderson, you started that conversation or that comment with not to get flippant, but at this point, I'm ready for y'all to get flippant. If you are still struggling with not wanting to do what you need to do to not get COVID, I'm ready for the doctors to get flippant with y'all. I'm ready. Vice Mayor, I'm sure you feel the same way.
Tropikana, that brings up a really good point. So I wonder, how are we doing in terms of vaccination numbers? Does anyone have the stats on that? Are we, are we like 75% of the population has been vaccinated or a higher number? Does anybody know? I'm just wondering, how are we doing?
Yeah, the numbers are not good from the standpoint of being boosted. It's still only about 17%.
17?
17 being
You
boosted.
have got to be kidding.
Nope, I'm not kidding. I am not kidding. And people have gotten vaccinated. I mean, the vaccinations are probably on the order of 70% for the first series. And if you're over 65, then those folks are a bit wiser, and they have been boosted to a level of 90+%. But everybody else has not been boosted. So the hope is with the FDA's new guidelines, which just came out today, that people will go out and get that single bivalent shot, and we'll get those vaccination levels up.
Right.
Yeah, that's incredible.
I also just want to touch on one thing in regards to long COVID, when we talk about like mental health and those symptoms too. A lot of people get misdiagnosed. So when we talk about fatigue or depression, or all of those symptoms, anxiety, sometimes we are put on different medicines, and is in the long COVID differential is not really overlooked. So biggest thing is that if you feel something is wrong, if you feel something is, off, there are COVID clinics in the city. UC has one. I think Christ has one too. So just make sure you get referred if you need to. They can always check you out and, rule you in or out for long COVID, but just don't stop when you know something is wrong.
But, here's the question. So once you get diagnosed for long COVID, I know we kind of touched on this. Is there anything that we can do? Like if we're diagnosed for long COVID, what then?
It depends upon what your symptoms are. I mean, there's so many different systems that can be involved with this particular problem. And so whatever the system that's involved, the care provider needs to address treatment for that particular system. If it's a cardiac problem, like a rapid heartbeat, then they may give you some beta blockers to slow down your heartbeat. If it's a GI problem that's causing diarrhea and pain, once you've ruled out the presence of some other problem by getting an evaluation and appropriate test, then you give medications that will treat that particular symptom. If it's a problem with your muscle aches, and it's a matter of making sure that there's nothing else going on, and it's a matter of treating it with with Tylenol or ibuprofen. So it depends upon what the nature of the problem is and what part of this long COVID spectrum that a person has fallen in, but you address your treatment toward that. If it's as Ms. Beckham was saying, if it's a problem with concentration or with anxiety, then maybe there's some medications that can be used for that. So you need to see your physician. Your physician can direct you to the proper specialist if necessary in order to be treated.
And then Tropikana, you said we can get flippant. So let me go ahead and get flippant.
Yeah,
so
go right ahead.
I need you guys to stop going to Dr. Google and actually go to your doctor. Okay.
I didn't mean get flippant. I meant them.
So everything that we have said means that you need to see your primary care provider to get these symptoms assessed. figure out what the diagnosis is so you could get the appropriate treatment. Don't come to me with WebMD and tell me what WebMD said, okay? So I need you to make sure that you're going to these doctors who are spending a long time in school to try to get you right, all right? So get to your primary care physician and get to them regularly, like Dr. Henderson said. Don't just go when you're sick, go on your yearly annual visits to make sure we can catch it before it even starts.
I'm glad you said that, because I want people to know that the city of Cincinnati has health clinics. I mean, we have health clinics. So if you don't have a primary care physician, you can easily get one. Go to your health clinic, go to your city of Cincinnati health clinic. I mean, there is no excuse not to have a primary care physician to take care of you.
But I mean, just like your car, you go get an oil change, you go rotate your tires, you get your car washed. You need to make sure your body is maintenance too. So all of those preventative maintenance will help to at least let you find out if there's something wrong so you can do something about it.
Now,
I'm sorry, Trop, go ahead.
Vice Mayor, I was just gonna chime in on what you said about the city of Cincinnati and the health clinics. When we were at the panel at Corinthian, one of the things that some of the people who came complained or mentioned was just their struggles with navigating the health system and finding primary care or getting answers. Dr. Jones, you made a very good point when you said don't go to Dr. Google and WebMD. But for those who have challenges, maybe financially or finding a primary care doctor, and you're looking for a second opinion, do you still want us to stay off of that? And don't bring that to you where we find? How do we navigate the resources that we do have for free, as well as, hear from the experts who have dedicated their life to this?
So that's an excellent question. So one of the things that's very important is to find a primary care physician that you bond with, one that you trust, right? And there are excellent resources out there. So every pretty much disease state has its own society, right? So there we have the Pediatric Endocrine Society. So there's resources there that are reputable websites where us as providers are actually providing the content. So there are reputable websites that you can go to make sure you're getting the information that you need. But if you do have limitations in your ability to see a primary care physician, just like VP Kearney said, we have the health clinics that you can go to. So there are, affordable healthcare agencies that will take patients who are underinsured or uninsured. So really, you should be able to see a primary care physician, even if you don't have the resources to do so.
That's a great point.
No,
And Dr. I'm sorry, Trop.
no, I was just saying there's no excuse. Thank you. Go ahead.
I was going to ask Dr. Henderson, at the Cincinnati Medical Association still publishes that list of Black doctors, the primary care, the specialties, all of that. Does the Cincinnati Medical Association still do that, Dr. Henderson?
Yes, it's just on our website, Cincinnati Medical Association.net. And there's a physician finder on that on our website.
Okay,
that link is actually available on COVID resources, community COVID-19 community resources. Thank you. There's a link to the Cincinnati Medical Association on that website as well.
Okay, COVID-19 community resources.
.com. Thank you.
Okay.
There you go. All right.
All right. Thank you.
Can we revisit the conversation on generational diabetes and kidney disease? Dr. Jones and Ms. Beckham, on the 7th, we spoke intensively about knowing your numbers. Can you guys explain what knowing your numbers mean and why it's so important to know them? Dr. Jones, then Ms. Beckham.
We're giving each other grace, trying to figure who's going to go first. So it's very true. So again, when you go to your primary care physician, you'll get some what's called screening labs, and these screening labs will have likely a fasting glucose, will have a fasting lipid profile, which is basically your cholesterol. It'll have liver function test on there too. They'll likely have you drop a urine sample to make sure that you're not spilling protein in your urine, which is one of the very first signs of very early kidney disease. And then you're likely, depending on what your BMI is or what your height and weight ratios are, get what's called a hemoglobin A1C. So a hemoglobin A1C is your average blood sugar over the previous 3 months. And if that number is between 5.7 and 6.4, that is pre-diabetes. And if that number is above 6.5, that is actually true diabetes. And so it is very important to know your numbers. So if you don't have access to your chart, you should, every hospital, typically every clinic has a patient portal or a My Chart where you can actually see your lab results and be able to, again, know your numbers and discuss those numbers with your primary care physician. Now, remember, every number that flags isn't an emergency, which is why you really have to have a good relationship with your primary care provider so they can help interpret those labs for you if you don't understand them.
Miss Michelle and Miss
I was gonna,
Paula,
yeah, thank you. I was about to ask Ms. Connor, Ms. Turner, go right ahead, Trop. I'm talking over, sorry.
we are thinking the same thing.
Right.
How difficult was it for you guys to incorporate knowing your numbers? How important was that for you on your journeys?
Well, for me, this is Pauline. For me, it was very important for me because once again, going back to when I first started with my symptoms of being just so tired and drained all the time, when I didn't understand that, I began to understand that, you know, pre-diabetes, and even also, as you guys were talking about the kidneys and having my test done, I knew my numbers and I understood all of that. And so it was very important for me to understand what my numbers were. And so I was thankful for that as well.
And how often do you get your numbers checked? Like, do you go?
Yes,
Yeah.
every 3 months. I'm getting mine checked every 3 months.
Okay. And are you seeing improvement based on lifestyle changes?
Yes, seeing improvements. Yeah, all all the way
That's
around.
encouraging.
Yes, so
That's
encouraged.
fantastic. Yeah.
Yes.
Michelle, have you seen improvement in your numbers since you changed those recipes? We got you on mute.
8.6 to 7.
Ooh, good.
Yes.
Congratulations. Ladies, can you give tips for people who have been maybe newly diagnosed and they're beginning their journey to changing their lifestyle? What are some things that you can say to encourage them, or what are some things that you wish someone would have said to you? Miss Pauline first, and then Miss Michelle, will you guys kind of share what advice you have for others?
Sure. I would like to say, you can't just make the change like overnight. You have to start gradually with your change. You know, if you know that, yes, you eat a lot of sweets, try to cut back, you know, don't just try to go all at it at once and say, I'm just going to stop eating the sweets. Get up and exercise, you know, do some walking, check your grocery list, change the products that you're buying, and just try to take things slow. Don't just try to jump all at once and say, I'm going to do it cold turkey. Don't do that. Just take things slow.
I wonder if it would help us to have some, you know, accountability with like a friend or family member to say, let's do this together. Because it's hard. It's hard making those changes by yourself, right? Like to stop eating the white bread, the white rice, all that stuff that turns to sugar. It's hard to stop with, you know, white potatoes. I mean, we eat
Yes.
all that stuff, you know, and that it all just turns to sugar. So you've got to stop. But it would help, I think, to have family support us in that, right? Family and friends.
I agree.
We
because
can all change together. Yeah.
Yes, I agree because yes, I have had to hold my sister. We hold each other accountable. Yes, and sometimes she'll want to say, "Let's go to IHOP." You know, I love the pancake, and I was like, "No, we're not going to IHOP. We'll change." Yes, we have to be accountable to each other.
That's good. It's hard though. So maybe to find something in place of that, like let's take a walk, or if we go to IHOP, maybe, I don't know,
Yes.
have some scrambled eggs, no salt, something like that.
And also, when you fall, don't just give up and lay there and roll in it. Get
Yeah.
back up and try it again and keep trying. Because sometimes the first time you may not succeed, second time you may not succeed, but eventually you'll catch on.
I love that advice because we're so ready to give up. We really want to give up, right? Because we want to get back and eat all that junk we know we shouldn't eat. But it's like, okay, we slipped up today. We're going to get back on track tomorrow.
Yes.
That is great advice, Michelle. Thank you for that.
Now, Vice Mayor, right before you got on, Miss Michelle was sharing with us about how she switched what she was cooking. She said she switched some seasonings that allowed her to readjust her taste and the things that she liked previously before she began to make those choices or those changes. Now, I did say at the beginning, I was gonna come back and revisit that. Are there certain things that you recommend that we try to give us a healthier lifestyle when we're eating those soul food things or the things that we love to eat?
One thing I've learned to use is a smoked turkey instead of using the ham hocks. The other thing was, instead of using a lot of sugar and things, I use coconut. She had me to use coconut water, but don't add any sugar. Just use the coconut water to make hot water bread on top of the stove. And it tastes delicious, and it can be fried in the olive oil. And so I was like, wow. So it's a little bit different, but it was just those little small changes, little bitty substitutes, you know. And also I got used to smoothies.
I love that. You ought to write a cookbook and share that. That would be great.
I'll be over on Sunday, Miss Connor.
Right.
Yeah,
I'm thinking out of your head, I was too. Like, you needed to know that too.
right. What about cauliflower rice? Has anyone tried that?
I have.
You can, I mean, I've started to like it. Has anyone else tried it? Do you like it?
I'm not too fond of it, but it tastes pretty good if you add some of that dash seasoning in it.
Yeah.
So it was okay. But I don't eat it that frequently. I'm gonna be honest with you. I really don't. Another thing I try is kale. I did not know kale could taste so good. And I was really surprised. My daughter and son-in-law, they turned me on to the kale and broccoli. That was one thing I was definitely running from. But that was a little bit of the dash, like I said, dash seasoning, onion powder, garlic powder, a little bit of that. Oh, and a pinch of olive oil for me, not them, but for me, just a little pinch. It makes it taste pretty good. And roast, oh, I'm sorry, there I go. But roasting vegetables too, roasting vegetables.
Roasted.
That was different and new to me.
Thank you for sharing those tips with us. I'm gonna turn this over to Ms. Vice Mayor Jan-Michele Lemon Kearney. She's my favorite. I'm gonna say that every chance I get to on here. Go ahead and take it.
Well, you know what? I think a good thing now to do is for each of our panelists to give us some takeaways, like what do you want to make sure we got from this conversation and that we do not forget? Give us your final remarks. And let's just go with Dr. Henderson. We'll start with you.
Well, thanks again for inviting me. First of all, I want to applaud Ms. Connor and Ms. Turner for being with us and for the progress they've made with changing their lifestyle. And changing lifestyles is very important as far as how we're going to go on existing and actually living. As far as long COVID is concerned, the way to avoid it is not to get COVID, and so get vaccinated. There are new rules that came out today, so it'll be all over the news tonight, I'm sure. So get your vaccination, still wash your hands, wear your mask when necessary, and take care of yourselves. Preventive measures are really what's going to be in your benefit in the long run.
That sounds great. Okay, Dr. Jones.
Yeah, I think I second Dr. Henderson. Just prevention is the best medicine, right? So get to your primary care physician, get moving and exercising. Nobody says you need to go do the Ironman, even if it's just parking far away when you go to Kroger's and taking a few extra steps and pushing that heavy cart up that hill to your car and loading your car, mowing your grass. So just get started with some physical activity. Make sure you're seeing your primary care physician, and then also make sure you get that support in that community around you, again, to keep you accountable.
That sounds great. Okay, Ms. Beckham.
All right, just want to emphasize it's not a sprint, it's a marathon. So small changes will turn into big things. So just understand yourself, understand that, your goal and making sure you stick to your goal. Like Ms. Connor said, sometimes you may fall off, but get back on. And also just to be aware, we are what we eat. And also our body has to maintain a lifestyle for a number of years. So making sure you're being good to it, caring for it mentally and physically.
That sounds great. Okay, Ms. Connor.
Just to repeat, repeating, regardless if you fall down, get back up, continue to do that until you finally can get up on that horse and continue to ride.
I love it. All right. Ms. Turner.
I just like to say, make sure you drink your water. Make sure
Oh,
you drink
yeah.
your water, how important that is. And also that knowledge is real powerful. So please make sure that you do find out what your numbers are and get some information on that, and everything will be great.
Well, panelists, you all are just also awesome. Just a great conversation. We've learned a lot, and a lot to look forward to as we make these lifestyle changes. So let's turn it over to our fearless leader, Renee Mahaffey Harris, President and CEO of the Center for Closing the Health Gap.
Oh, you got, well, first of all, I want to thank the panel. You all, each of you, Dr. Jones, Felicia, Dr. Henderson, Tropikana, and Jan-Michele, thank you all. And Bluezette, thank you to your chapter of the Links, Cincinnati Links chapter, for hosting this conversation. And I really want to give a special big applause to Pauline Turner and Michelle Connor. They are part of our first inaugural Diabetes Challenge that's hosted at Hirsch Rec Center. The participants receive a lifestyle coach, fitness instructor, nutrition instructor, and hopefully you're having a great time, and it sounds like you're learning a lot of new tips and tools. And I think each of you, we got to keep doing this work together. Dr. Jones and I talked about these conversations on the generational outcomes, and that's the urgency that we have when we hear numbers about our babies who are under the age of 18 being diagnosed with diabetes, type 1, type 2 in particular, right? We have a crisis on our hands. And so we, our big community, have to really begin to work together to build greater knowledge, but also understand, as Michelle and Pauline, who are sisters, are working together and holding each other accountable, what we need to do collectively to save each other's lives. So thank you all for being a part of this conversation. And again, I want to thank the Links chapter for all the work they're doing and really building greater awareness, not only on the issue of kidney disease, but the linkages to diabetes and other diseases that are disproportionate for us in our community. I thank you all. God bless. And we're going to continue working together. So thank you. Have a great evening.
You as well. Thank you. Thank you, everybody.
Bye.
Thank you.
Bye.
This was good. See ya.
Bye.
Bye.